both those of you who are here live and those who will be listening to this earlier on, like you find in the description. Okay, we are going live for a maiden episode. We're going to have series of episodes. We're going to have series of playlists, and we're going to have series of seasons. Okay, to this term. We want to say that you're welcome once again to MSc Mastery YouTube channel. This is where we aim at providing you with measures to internalizing and mastering your courses in medicine. Okay, if you are in medicine, or you are just reading medicine for fun, or you are doing medicine part-time. All right, so we said that you are going to make sure that you have a bird's view of what we are trying. This is a test run. We want to see if this works. We want to see if we can use this media to record concerns. Because you see, many a times we don't have the time to leverage on what we know. What do I mean by that? Okay, we know how to share information with people and get people to understand some certain concepts, but you discover that we cannot listen to those wonderful sessions again, either because people don't have time. So we are trying to say that you are going to help us make this work. We have some wonderful ways of learning bulky subject in an easy way. For example, we are saying, let's gather and demystify anatomy. And you're here, and we said that once we host live session, we are hoping to make sure it's recorded, okay, and usually replanned or reshaped to fit the need of students for exams. So we are going to have several sessions, and we're going to trust God to help us record them so that it can be made available to you. Now, this is introductory, and it's not going to be talk all through. We're going to be using board. We're going to be sending shots. We're going to be having live session with people. Do you follow? Thumbs up if you are with me. So now the anatomy of upper and lower limb, anatomy of thorax, abdomen, pelvis, and perineum, we said can be reduced to a piece of paper. That piece of paper is what I call anatomy table of values. Do you follow? Thumbs up if you are with me. So, for example, in your first year medicine and surgery preclinical year, okay, or your second year medicine and surgery preclinical year, or your first year clinical year, okay, we are going to have a lot of episodes but reduced into demystified volume using some measures, okay, that you are familiar with. You see, a lot of people say, studying medicine. You know, sometimes when you are encouraged to go study medicine, or when you on your own want to study medicine for whatever motivation or drive, and you discover that seeing is not the believing. Before now, you hear seeing is believing, but when you stepped into medicine, you discover that it's not what you were told, that is what you're seeing. Okay, but it's not, no problem. You are here, you are there. We can actually make medicine enjoyable. You know, some people wonder, is it possible to do medicine and also a kind of how do you call it? Have time for your hobby, have time to go spiritual, have time for your entertainment, have time for your sport, have time to scroll through, you know, your social media and the rest of them. Well, maybe this can help you, even though many don't recommend that, but maybe this to an extent can help you, because sometimes some people, it's not really the hobby or the sport, it's not really the entertainment or the scrolling, but some people, it's like they need to take care of themselves. Some people, they need some time to do one or two, to put body and soul together, maybe to support the sponsorship they are getting. But now here's the point. We are looking at anatomy. Okay, in this series, we start like afternoon series. We'll be looking at anatomy proper. We'll take some of the topics and we'll demystify, reduce it to a piece of paper, do it in piecemeal. That's what we are looking at. Yeah, that's what we're looking at. So we encourage you, subscribe to the channel, give your comments. Even though when you comment, we may not be live that time, we are going to put measures in place. We are a team, we are studying, we are using this media and measure to study. Okay, so because you see, studying is not interesting, it's not a home movie. You see, somebody can stay all night singing, all night dancing, all night talking, gisting, gossiping, all night playing. But if it is reading, you need extra discipline. But you see, with these sessions we are going to be hosting, okay, we've raised team of study partners all across, and we are training them, and you are going to be one of them. Okay, forget your past, forget you have been written off, forget you have nothing to write home about. But the truth is, if you are committed, if you are dedicated, and you drop messages, guess what? We are going to create measures to make sure that your message, especially your question, okay, or your comments, or the topics you want us to make video on or to go live on and explaining, using maybe board, or using maybe AI, or using maybe sticker, or using reference material, or using lecture notes, or using PDF, or using whatever audio, like audio. Yeah, yes, audio. You don't believe some people record audio? You guys to record audio as a medical student, you're going to have a whole number of volume of work that, guess what, you can't, your Bible and your ears cannot pick the two. It's not possible. Sometimes a lecturer is writing and he's cleaning, he's explaining, he's asking questions, doing 2, 3, 4, 5 things, and he's getting angry and expecting you to feed his request. So that's why you need to record. You record your lectures. All right, so those recorded lecture, if you didn't understand them and you want us to make video on them, no problem. DM us. You drop a comment. You like, you share. So this is going to be very, very good to those in medicine, especially in Medical and Dental Council of Nigeria. That is MDC. Those who are studying medicine in this sub-Saharan region of Africa. Okay, so share with your friends abroad, share with your friends in Nigeria, friends in your school, friends in other school. So each time we come to study, you see how we study. We study live, okay? We have tiring day. You see how we manage, okay, tired sessions with... Please, if you are close by and you are joining, please excuse us, okay? Take a little bit away so it doesn't distract the people from re-echoing. Do you understand me? Please. Yeah, if you're close by and you're joining, there is no point. Okay, you're joining this live session or you're listening to this session, let it not be, if you're replaying back, let it not re-echo. You move away or you reduce your volume. Do you follow? Thumbs up if you're with me. All right. Okay. All right, so like we are saying, okay, subscribe, share with your friends, share with your enemies, share with your neighbors, because we're going to be having sessions for past questions, sessions for textbook, sessions we are going to co-host, session. You see how we study despite going to class very early, coming back tired, and all those responsibilities needed from you, and you still create time to study. You're going to be hosting this. So that's what this session or this channel is all about. This is a maiden session. This is a maiden episode. This is a maiden series. We are trying to make sure that we turn study to become entertaining, to become charming, to become interesting, to become mesmerizing, to become captivating, to become something that you can do all night, all day, and without getting tired. That's the goal of this channel. Okay, because to be frank, you are not alone there, that you look open book, only God knows that you were not reading. You carry a big bag, big textbook, the world thinks, in fact, the world is envying you for nothing. The world is envying, oh, my friend is studying, oh, I can see a medical student, oh, he's carrying big, we look like a medical student, oh, he's only you and God plus Satan knows that you are not reading anything. And when you try to read, it's not entering, it's not being internalized, it's not being read. Am I communicating? Thumbs up if you are following me. You like and share. If this is, yeah, beautiful, good. Keep them coming, keep them coming. Do you follow? Do you follow? Do you follow? Yeah. So we're going to be teaching you a whole lot. We have a whole lot. How to read once and you retain forever. Oh, that sounds impossible. You're going to see some beautiful thumbnails here and say, master 17 muscles of the scapula in 5 minutes. How? You're going to hear things like Watch this sentence because it may be taken down just any time. You're going to hear wonderful stories and wonderful things that once you can do that. And some people say, I love Jesus, I love church, I do religion. How do I couple it with this message? Is it possible? See, this is where we make use of acronyms and mnemonics. And we're going to be teaching and we're going to be using it, not just teaching. It's easy to teach and not reach. Yeah, it's easy to say something and not do something. Oh, okay. Question you never want to be asked. Okay, so here's it now. Is there any question you never want to be asked? Okay, so I don't know. We are just trying some features on this, and we learn. Learning is a gradual discovery of our ignorance. Yeah, learning is the gradual discovery of our ignorance. They said, subscribe, turn on notification, and okay. So what else do you have there? Welcome to. Okay, please don't laugh. But if you can't, it's part of life. Laughter does good. Like this. We are still trying to learn how to use this media to study. To study. You see, if you really notice, many of us, and you are not alone in this, so don't feel guilty. Many people can scroll through YouTube from morning till night, but to use it to study is not possible. So that's why, okay, I and friends, we join hands together to make sure that we study using YouTube live session. Are you following? Where we can go live and we study all night. We can gist on phone. We can talk about, argue that muscle, argue the nerve, argue the lymphatic drainage, argue the structure and everything. So we've been here for 11 minutes. We'll keep on practicing this until we can master the whole concept. Is that okay? We are still learning. We are still learning. Okay, so while we're learning, let's be earning. While we're learning, let's be gaining something. While we're learning, let's be suspending pains. Do you follow? Okay, so now, all right, let's get into anatomy. All right, this is for beginning. We are beginning with preclinical students. Okay, we are beginning with preclinical students. Please, if you are joining, give us your thumbs up, give us your comments, subscribe so that you'll be able to comment and be able to appreciate what we are doing. Okay, do you understand? Don't just watch, just make sure you give comment, you like. Okay, be polite. If there's something you don't understand, there's a line of thought you didn't get. Okay, you can do what you can as well give your question. And if we don't, if the weekend is over, we're going to try our best to attend. And the ones we are too busy, either because of the number, we reach out to our study partners who are trying to learn that question, which we have trained and teach, either in the live session or in the semi-live session. Do you follow? Thumbs up if you are following me. Okay. So now let's move on. Okay. There's something that pop up and is trying to. There's something that pop up. It said questions you never want to be asked. I don't know. It's a feature. I'm still trying to. Let me see, what is this one for? Okay. So what is this one for? Okay. Say share with your audience. Let me see. Pick up if we can. Me now. Thumbs up if you can hear me. Give me a thumbs up if you can hear me. Thumbs up if you can hear me. Come on, give me your favorite. Okay, good. You can hear me. All right. So now we are saying that let's dive in straight. We said let's gather here for anatomy. This is anatomy simplified. All right. Now, anatomy has been dreaded by many preclinical students, either before they get into school or before they get into preclinical class. When we say preclinical class, it means you're year 2 in Nigerian medical schools. Okay, that's preclinical class. The preclinical class is year 2, that's the first preclinical class. The second preclinical class is year 3, which is usually called the MB class, examination class. Now, anatomy, yes, is the bulkiest. And the problem is not that it's bulky. The problem is it is strange. It has a lot of strange words that most of us, okay, or most people, all right, who did not have this appreciation earlier enough, okay, are going to find it distracting or disturbing. All right. So what do I mean? Watch this now. We said when somebody is in nursery school in the sub-Saharan region, most part of the school, secondary school, nursery school, when it's in nursery school or in primary school, they said this topic is above our level. When you get to secondary school, they will teach you. Now, when that person get to secondary school, they said, welcome class, this is where we stop in our scheme of work. Okay, that's why you need to go to university or tertiary institution, polytechnic, so that at there now, you'll be what? You'll be shown. And when you get to university, guess what? A professor comes in and says, you are supposed to know that in your SS1. Can you imagine that? Can you just imagine that? You know? So we live in a world of brainwashing, like, you see. So that's why you hear some captions like, we are going to be doing some of those captions, things I wish I knew if I was in year one, things I wish I knew if I was in my first prelingual years, how I would study anatomy if I knew, how I would have approached study of bone, study of muscle, how I would have approached anastomosis. These are topics in anatomy, what I would have done. So you hear a lot of funny things. But in this channel, we're going to show you a whole lot of those things, okay? We're going to try our best to make it simple. Now, it's been 15-16 minutes into this video. Let's get into anatomy. Now, for your preclinical years, anatomy taught to you is regional anatomy. But as a medical practitioner, medical student, okay, the anatomy expected you to know is mingled with clinical anatomy. Regional anatomy is the parts of the human body, but clinical anatomy is not just the application or the function of that human part, but what will make that to come to hospital, or what will make that person, okay, that structure to bring somebody to hospital. That's clinical significance. That's how it's called. Meaning, as we talk about anatomy is not complete until you learn the applied anatomy. That's the application of that anatomy. For example, talk about the anatomy of bone or the anatomy of upper and lower limb. This is the upper limb, okay, and the leg is the lower limb. You can see your leg is the lower limb, all right? And the head and the neck is another anatomy. And then the thorax, okay, from the region of trunk between the neck. The abdomen is called thorax. And then the abdomen is what people... When we start looking at thorax and abdomen, you'll be surprised. And he's bulky. Yes, he's bulky, but guess what? If you have the brain skill, they totally hard, and which are the things we are going to be sending. All right, we started a little. If you have seen our shot, we need to take a little break. We've gotten about so much subscription. Is it really so much? We've gotten some people are subscribing, some few people have started viewing and people are subscribing. We want more so we can reach out to many people. In fact, it will interest you to know that some people are committing suicide. In UNN, the other time, a friend told me of a history. Students are committing suicide because the work is too much and parents are mounting pressure. He said, my son is not doing that, my daughter is not going well, and I spend so much and all that. And this is a very wonderful time. As I study with you, we study together, you study with your team, we raise team people who are studying inter-school, and guess what? It's going to make sense because you can't do operation alone. Yeah, no sound, interesting, mysterious operation is not. You need assistance, you need co-surgeons, you need auxiliary nurses and all that. Okay, so the same way, just that the working will not be alone in isotone. You will be working with MLS, you'll be working with pharmacists, you'll be working with nurses, you'll be working with other paramedicals. Why not let's study together? So bring your friends in paramedicals, let's study this together. Do you follow? So whether it's your enemy or your friend, drop it on your timeline. Let's learn, let's do this together. All right? Instead of us coming back and we are tired and we sleep, we wake up to meet another lecture, we come back again, the thing is accumulating, waiting for us, and before you know it, zero. Why not let's use this media? Okay? Let's to study, to learn. Okay? So that's the point. Are we together now? Okay, so this, like you said, is a test run, and we'll be doing recorded videos and send recorded shots and send it. The live session is also to keep us active and to record it for those who could not meet up. Now, we'll be doing a lot of live sessions and a lot of recorded sessions, a lot of shots and a lot of long videos. Please, I want you to watch, want you to go through, want you to listen, want you to do all you could to make sure that we have the best. Is that okay? Now, for this afternoon session, is by 12:05 afternoon session. We are going to do that session again, okay, for afternoon session. This morning session is just a test so that maybe 30 minutes or maybe 40 minutes or maybe an hour, just to discover, just to learn and see how it went. You know, did it really go well? Because we don't want to start keeping board and start teaching, or don't want to start explaining something to people and showing people book and showing people diagram, you know, and showing people structure and showing people parts of the body, and then and all that, and there's another, and we are not getting feedback. We want to be getting feedback. We want to be getting feedback. Okay, when getting feedback, is the live session better than the audio recording? Because I feel if I'm recording, there are some things I might not know. But if we are studying, like sometimes we'll be doing this live session with other people, we co-host, we co-live with other persons, other schools, other students, higher level, junior level, same level, lower level, till you get colleagues and all that. People are finished, so that if we will practicing doctors, practicing medics, so that we can be able to appreciate. Okay, instead of just come back, we are tired, cook, eat, or buy food, eat, or you come back, they've closed canteen, or you sleep hungry and all that. You go back again, nothing is done. We can be doing it in piecemeal. That's the aim. Check out the aim of the channel. Check it out. Subscribe. Check it out. Okay, click one or two. The first shot we made was like, welcome to MSc Master. Okay, where we, you know, internalized, okay, demystified medical course. Just watch that. Okay, that's the greatest, and I think 8 seconds. I know that. And so that's the thing. We just want to use this to check up and all that. So, and then we'll be doing a lot of this. Okay, we'll do a lot of this. All right. So before we end this, I want you to understand, in case you are joining for the first time, because many people have DM our team leaders, our team members, okay, that we are working with. They are saying, please let's this facilitator, let this fellow, let him start again from the beginning. I mean, how can he finish thorax, abdomen, pelvis, and perineum in less than 1 week? How? How? He reduced the whole of 48 topics in anatomy to just a piece of paper, and he called anatomy tables of value. I mean, like the other time he was saying he's going to send a video on how to study all the 120 bones, excluding the bones of the pectoral girdle. And then you may be asking, which one is pectoral girdle? I've not heard before. Sorry, you were not the first. There are many people who did not. In fact, there are many people now who are almost getting into clinical class, who, if you ask them, show me their pectoral girdle, they'll go and touch head and neck. They'll go and touch it somewhere else. Okay. So you are not the lot. So we want to, because the kind of generation that we are, Indomie and Bobo generation, scrolling and AI generation, you know, generate AI for me. If someone come for clinic for clerking and they said, I have this, you type it on AI. In fact, it doesn't even need to type. As you're talking, he has turned on voice recorder and AI will generate, and he will do it as if he's getting serious and it's really need to do. No. We want to see a generation, we want to raise a generation that if you say medicine, it's either they are sure or they leave it. Either they diagnose it or they refer. If they don't know, they leave it. Yeah, that's a doctor. D for diagnose. It starts with D and ends with R. So if you don't know it, you refer. That's very simple. You are not. You know, it's bad that it's only in some parts of this part of the world, sub-Saharan region, Africa, that you see someone say when he's a doctor, he can prescribe, he can diagnose, he can treat, he can inject, he can do for ear, he can do a lot of things. There should be specialization. Do you follow? There should be specialization. So this is one of the aims of this thing, to help us master our concept, to help us master our work, to help us master what we are called to do. Okay, so that's just the thing. Anatomy is not difficult. It's only that it's not interesting. But these sessions and this channel is going to help us, okay, make anatomy interesting. And not only that, if you're not in medicine and surgery, okay, maybe you're in nursing or you're in pharmacy, and you want us to help you in some topics, because the truth is, some of the topics or some of the courses you are doing, we are sharing those topics and those concepts together. And we believe that if we join hands together, we can learn. So now, before we end this session in the next few minutes or so, we said your second, if you submit it to something tangible, your minute will be meaningful. So instead of doing things that are not meaningful, why not join us? Why not join us? Maybe you are there, you are assisting your parents. Maybe you are there, you are doing your whatever you're doing. You can DM us. Let's go live. Okay. Maybe you're waiting for lecture, like sometimes we do wait in school. Okay. Or others, comment. Okay, I want this to be re-explained. Can you make a video on this and all that? Okay, and all that. So that's all what we expect you, so that, because if you challenge us to work, we work. When you work, we work, we all work fine. So that tomorrow I cannot be treating myself. There are just some things I can't do for myself. I will need a fellow. So why not they study together? That's by the way. Let's speak anatomy. Okay, anatomy of the upper and lower limb. Anatomy of the upper and lower limb. So the upper limb are your hands. Can you see your limbs? Okay, now anatomy generally is divided into 5. All right, the first one is upper limb, the next one is lower limb, the next one is embryology, the next one is histology, and the last one is practical. Although in some schools, practical anatomy for upper limb, practical anatomy for lower limb, practical anatomy for embryology, practical anatomy for histology. Are you following it now? And general practical anatomy. Some schools, they do that. Some schools only do general cadaver practical for upper and lower limb. They have for histology and they don't have for embryology. Others have for embryology, they don't have for histology, depending. But there's no excuse, okay? Because you see, if you are asked to pay money before you give excuse, you never make excuse, all right? So the world is waiting for us, okay? Our homes, family, church. I tell you story, oh, my friend, my brother, my sister, my uncle, cousin, all my neighbor, town people and all that are studying this because they expected so much from us. So we, when we are undergoing the training, we must make sure that we are actually retaining as we are going the training. If you hear here, yes. As we are undergoing the training, we should be retaining the earning. We should be retaining the concept. And so this concept, okay, will be done doing some measures. So now we move into anatomy of the. Now, anatomy, yes, we said upper and lower limb. That upper and lower limb is for your first in-course work. It's for your first in-course work. Okay? Hi, yeah, someone is saying hi. Yeah, hi. Okay? Sambo, hi. Okay? Yeah, from your school, from where you're coming from, hi. Yeah. So, but now, every other person will be saying hi, we try and respond like that. Although we don't have that time to. It's a medical student does not have a social life, but a medical student, okay, that we are, whatever is going to take us social, it's going to be academic. All right, we are responding so that we say, oh, somebody asked question of pancreatic duodenal. What does that mean? Is that even correct? And we say, wow, let's check. Let's see how to help this person. We internalize it. We discuss it. Because we are going to be sharing how to retain this thing. We are going to practicing it. You're going to see us do it with the topics. But now let's speak anatomy. The one I mentioned to you, anatomy of upper and lower limb, is for first in coursework. Now, the histology and the embryology they will teach in first in coursework is going to be general histology and general embryology. By the time you get into second in coursework, we don't say second semester in medical school. By the time you enter preclinical class, we don't say semester again. We said preclinical, clinical, all right? And then postings. That's what we talk about. Okay, so your second in-course work, okay, usually the second semester into the first semester of year 3, okay, is going to be talking about systemic histology and systemic embryology. And that one is going to be talking about not upper and lower limb again, but thorax, abdomen, perineum, thorax, abdomen, pelvis, and perineum, usually called TAPP. Now, hear me and hear me closely. Hear me and hear me closely. As you get into the third in-course work before your MD, okay, what we call second MD, right? Second MD. You discover that you'll be doing head and neck, from here to here, head and neck. But this one you'll be doing the first year. Now, every in-course work gets demanding, gets bulky. And I believe that as you join us to study together online and live, you are going to enjoy this session. Like I said, the next session we are going to be doing is going to be by 12 in the afternoon. We try and see how to co-host it, how to make it interactive, how to either bring some people who are far away somewhere, we link it so you talk, we talk, and all that we communicate. Just like it happened in Google Meet. Are we together now? Because some people say, Google Meet, we are not getting feedback. You are the one talking and all that, and this has not been your style. This is another, paradigm shift in your niche and all that. So whatever is the case, don't worry. We have you all covered. Okay, studying with you and storing it with you, retrieving it, practicing it is our goal. So we're going to start up and lower limb again by afternoon, okay, and we are going to start thorax, abdomen, perineum, and pelvis again, okay, by night, and we are going to start head and neck again by tomorrow. We're going to start head and neck again, and we are going to start all these things. So we have almost finished all of them, structural, or should I say, skeleton. We've finished almost all of them, okay, but we are going to start it over again and be adding it. Remember, we study in piecemeal. We have scrolled through it and we're going to do that again. It is believed that despite the hours you spent in anatomy, you should do what? You should spend 3 hours reading anatomy. But you see, reading doesn't work. Reading doesn't work. Many people have tried reading, it didn't work. So it's time we need to try something else, because we said it is insanity to do the same thing and expect a different result. If you have been reading and when you close your book, they ask you what did you read, even you, when you see question, you begin to wonder whether you are reading or you are playing, You see, so we are going to be trained that. So anatomy, we'll be picking that again in the afternoon, okay? Interactive session will happen in the afternoon. We try and see how to connect this thing in the afternoon, okay? How to connect some people, some groups and all that. So we get, with the feedback we get, is really going to help us to know if we keep using this life, or how often do we use this life and all that, okay? Now, moving away from there, let me just give you this brief about anatomy. I've already told you anatomy is divided into 5, okay, in your first preclinical year. That's year 2. Year 2 is called first preclinical year. The second preclinical year is year 3. All right. Now, but your university first year is year 1. I hope you get the point. Okay, now let's move on. Now, we said that anatomy is divided into upper limb, TAPP, head and neck, 3. That is, the first in-course work is upper and lower limb. Second in-course work is thorax, abdomen, perineum, thorax, abdomen, pelvis, and perineum. That's TAPP. Whereas third in-course work is what? Head and neck. Do you follow? All right. The histology and the embryology is similar. All right. Right? General histology, systemic histology, okay? Neuroembryology and all that. Do you follow? Thumbs up if you are with me. Comment, write comments. Let's know if you are with me. Active community, yeah. And then if you are playing this back, because I'm saying a whole lot of things you need that needs to be played back. If you are playing this back and you are watching a playback session, you comment. It will show notification and we'll respond to you. Maybe within 24 hours to 1 week, we'll respond to you, because we keep studying new things, we keep teaching new person, we keep hosting new sessions. So a lot of video, a lot of playlists, a lot of things will be coming online. So the more you are checking, as interesting it is, the more it gets to make sense. Are you following me at all? Do you follow me? Okay. Now let's pick up and lower limb, and you're going to see what I'm going to do now in up and lower. It will shock you. Up and lower limb, if you discover, it has about 25 weeks you should use to study up and lower limb. If you check your anatomy alone, by the way, I hope you know, it's not only anatomy we'll be doing in this session, but facing one course until you succeed is a true spell focus, F-O-U-S. Is this to know? F-O-U-C-S. F for facing, O for one, C for course, U for you, S for succeed. So face one course until you succeed. That's why we are facing anatomy for now. Okay, a time will come, we'll face physiology. Time will come, we'll face, we're going to face, how do you call that guy now? Biochemistry. And some people say, oh, can you do our general course? In our school, they are doing GST, general courses, aside from the departmental, anatomical, physiological, and biochemistry course. Well, if you want us to do that, we DM us. We have a team of those who are, because we train. Leadership has 5 levels. Okay, the time you do with, there's a time you allow people to do it, make the mistake, you correct. There's a time you are absent, and if they can do it in your absence, if this thing can continue. So we're raising people who can do some of those things. And if it's something you are not fulfilled getting them done, we'll step in. Is that okay now? Thumbs up if you're with me. All right. All right, so now let's pick anatomy, all right, and discuss. Anatomy for upper and lower limb have 25 weeks you should discuss that should be used to teach you. 25 weeks. 1 month has 4 weeks. So now divide 25 weeks and know how many months you need to study anatomy. But not even study, as in that scheme of work, I'm telling you, that's a scheme of work in an average university. Some school may add a little more, some school may reduce a little bit more, but it cannot be less than that benchmark. My point, 25 weeks to study anatomy of upper and lower limb. That has nothing to do with embryology. The scheme of work does not convey embryology. I'm just talking about anatomy of upper and lower limb. That's your from the waist region down, where you have the hip bone, okay, the thigh bone, the leg bone, and the foot bones, okay, and all the neurovascular structures, okay, and fascia, muscle, and nerve, and all those anatomical structures that are on them, okay. So just upper and lower limb, 25 weeks. And when I check, I discovered they have about 48 topics. 48 topics. Can you imagine that? Now, if you are in year 3, ask yourself a question. Or if you are in year 4, in fact, if you have finished first preclinical year, ask yourself, have you read up to 48 topics? Okay, that's so conclusive, that's so extreme. Have your lecturer covered 48 topics? And let's be honest with ourselves. Are you seeing it now? Now, but I'm going to tell you that those 48 topics, this channel is going to help you understand it. Not only that, this channel is going to help you look at it as simple as A, B, C. 1, 2, and 3. Yeah, simple as that. It's very possible. Just stay consistent, keep showing up, keep checking the channel, keep viewing, keep sharing, let the view increase, share with others. The best way to have is to give. The best way to get is to give. Do you understand me now? So don't say, I've stumbled on a channel that's going to go like, going to teach me that. No, don't do that. Share. Okay, share. It's when you share, you become an heir. If you hear, say I hear. Now, anatomy, like I said, there are 48 topics, 4 and 8 topics. Can you imagine that? 4 and 8 topics. 4 and 8 topics. 4 and 8 topics. Those 48 topics can be studied under 7 major topics. What do I mean? If you check that schedule, I'm telling you, if you drop on the comment, I can send you this schedule, an average, or you pick your own for your school. See, it's about 48 topics that should be lectured in 25 weeks. I calculated that if you have to study anatomy, you need 60 days. If you have to read anatomy, not even study, you have to read anatomy, you need 60 days to cover those 48 topics. You know what that means? That's not beans. I have tried something. Sometimes some people, when they read something once, they don't get. You need to read it over and over. Some people need to use spaced repetition. Some people need to use Pomodoro method. That's they read after 25 minutes, they go take a walk or gist or browse or do something else and come back. Whatever method, there are a lot of them. The important thing is, I've noticed, watch this now. I've noticed that some people don't just read once and get it. Only few people read once and get it. In fact, some people, when they read and they see one word, they will need to watch 10 videos, 100 videos, check channels. Okay, to understand one thing, guy, if you are like that, you spend years in preclinical class. And not only that, in fact, you'll be like somebody I saw somewhere said, okay, he has passed, he's now a good doctor, he's going to start medicine again, year 2. Can you imagine that? Why? He was just trying to pass, either try a mirror method, or guess what? Now he wants to sit down and read now and store it, retain it now, and load it in his gray matter now. Why? Because he knows that the person you are dissecting might get you into prison. The person you are going to be doing surgery on, the person you are going to be diagnosing, the person you are going to be prescribing, the person might get you into trouble. So it's not a guesswork, it's not messing. You deal with life, you are not guessing. In fact, for dealing with life, your own life, you are dealing with your own life. That's the meaning. You put yourself in the clue. If I was to be on that stretcher, if I was to be on that sphygmomanometer, if I was to be on that, how will I feel? How will I expect to be treated? As a medical student, a lot will happen to you. So, let's reduce anatomy of upper and lower limb back to points to 17 topics. When you start, you hear history of anatomy. When you start, you hear anatomical terminologies, classification of joints. You hear types of joints in the upper limb, joint in the lower limb 1, joint in the upper limb, joint in the lower limb 2, bones of the upper limb, bones of the lower limb 3, arteries of the upper limb, arteries of the lower limb 4, lymphatic drainage of the upper limb, okay, 5, venous drainage of the lower, 5. You're going to hear anastomosis 6. You're going to hear arches of the foot. You're going to hear palmar arch. You're going to hear spaces. You're going to hear, am I communicating? You're going to hear a whole lot of plexuses, a whole lot of, triangles. You're going to hear triangles like, watch this now, large posterior anal triangle, smaller anterior urogenital triangle. You're going to hear femoral triangle. You're going to hear a lot of quadrangular space, upper triangle or lower triangle. You're going to hear a lot of things. Lower triangle, upper triangle, quadrangular space. You're going to hear a lot of carpal tunnel, a lot of retinaculum. In which, by the time, if you are just entering preclinical class, I promise you, except you didn't pay attention, by the time you find the first professor, the first professor that comes to teach you is good, and he's teaching from his brain, and he's giving you the notes from his brain, and he's not using any book, and he's trying to talk. By the time he finishes 2-hour lecture, or 3-hour lecture, or 4-hour lecture, in fact, by the time he's done, you will not know when you begin to jam your hand, because you have never seen that kind of presentation before. But guess what? The goal while you're not in school is not to go and clap hand for professor. The goal of a student is to become a teacher. Yes. So the goal of you, a medical student, is to become a medical professor. You should be a defender of that thing, a presenter of that thing. In fact, the goal of this channel is to fill in that gap that your lecturer left with you, which they did not have that time to convert you from a student to becoming a professor. Is to convert you through this channel now, and the procedure and the view and the audio and the short and the video and the live session we raise here is to be able to convert you from just sitting down to warm the chair to rising up to practice. That is why you need to join the follow-up MSc Mastery WhatsApp channel. Join it, the WhatsApp group for the different institutions. As we study together, we test ourselves, we ask ourselves questions, we argue on sessions. Do you get my point? They say, no, it's not femoral artery, it's inguinal. Do you get my point? They say, there's nothing like that. There's nothing like pelvic diagram. This one say, no, how can you say there's nothing like pelvic diagram? There's pelvic diagram, there's a thoracic diaphragm, there's this. Do you get? We discuss the same way people will gather and discuss football that will never put them up. Do you get? The same thing people will sit down, gather and discuss bone straight, yet their bone and their life is not straight. You don't get that point. That's the same thing. I want us to bring the same energy and synergize it to synergy to be able to get this kind of me. Yes, that's what we are looking at. Okay, that's what we're looking at. So join that, because whatever we do here on video and shorts or live session, you need to practice. We need to have another session that we get to, oh, did you learn something? Did you take notes? Where did you miss? What can we fill up in the gap? Drop your comments and everything there. Do you get? Yeah. So we'll be handing to you tips. Okay, we're handing to you a lot of beautiful, easygoing mnemonics. And if the mnemonics we are using is difficult, maybe you are not a football fan type, or maybe you are not a religious type, or maybe you are not a, how do you call it now, education friend, you don't love too much blue, and so the mnemonics they are using or the acronym they are using is into you, or it's turning your brain down, or not giving you vibe or something, you can DM, you can message, and we'll be able to get you. Do you follow? Thumbs up if you are following me. Come on, thumbs up if you are following me. Come on now, come on. Give me an emoji if you are following. Drop a comment. Yes, those of you are playing it back. Yeah. Drop a comment if you are following. If you are not following, ask questions. We'll answer you. Don't just come and say, oh, fine channel, you're a good teacher, you're doing well. No, yes, it's good, we like that. That's why we say like, and like, you give us the like. But guess what? Aside from the like, also ask questions. It shows that we are communicating. We have a platform to learn. Do you follow me? Are you with me now? Okay, all right. So now, okay, anatomy. I said it has 25 you are supposed to lecture you, and you need about 60 days to read it. I didn't say study. When I say study, a topic, a name you didn't know. For example, tuberosity. What's the difference between tuberosity and tubercle? Now, what's the difference between tubercle and trabacule? Are you seeing it now? Have you heard that kind of thing before? Imagine you are reading and you are seeing all those things. People seeing physics. You hear things like 𝔸𝕟 process, transversal. You hear things like costo transverse joint. Which kind of thing is this? What kind of, I mean, he can turn someone mad. All right, can turn someone mad. What is mad? Making a difference. It's not the negative madness, making a difference. And medicine and surgery, or anatomy, or physiology, or biochemistry, especially anatomy that is very bulky with this strange word, can do what? Can actually make you to begin to study differently. Forget that one. You say, I'm not the type that read book. I'm not the type. Don't worry. Medicine will, I'm not the, we don't tolerate, not medicine will make you tolerate a lot. In fact, there's a time they're going to teach you, medical psychology. Say you don't talk back at your patient. You don't get angry. In fact, medicine is going to mold you. It's going to melt you first. Then it mold you and make you to become a master. And that's what this mastery is about. We hear that here. Don't stop. All right. So now let's talk. We've been talking for the past 45 days to be able to work on your mindset, because you see, a successful person, a succenaire, just like a millionaire for money, for knowledge, we say succenaire for progress and advanced succenaire. A succenaire is not a person with handset, but is a person with mindset. So the mindset needs to be corrected. Are you following? Yes, you have to think right if you don't want to stink right away. So now we pick anatomy, 48 topics, 25 weeks. You have to read it 60 days. Not study. In fact, sometimes I remember when I started, when I said I was going online trying to check how to study well, how to retain, how to study once and get it right. In fact, there was a day, the first day a lecturer came to teach about scapula and the 17 muscles on it. Guess what? It took me 12 good days. And I still did not get the names. So not even the nerve, the blood, the cause, not even, do you get, not even any on the clinical application of those muscles, just the name, 17 muscles. And we are going to be doing that in this session. Okay, in the afternoon session, we'll take 1 minute. It took me 14 days. The first 12 days, I had to ask for help from the 13th day. It was on the 14th day that I was able to master the 17 muscles of the scapula. Can you imagine that? And so we're going to take you in piecemeal, how to master it, how to know that you don't need to wait 12 days. Imagine you wait for only 17 muscles of scapula alone, and there are about 100 and something muscles. So many muscles, their numbers and bones, So if it takes you 12 days, can you calculate how many days it will take you? For scapula alone, for upper and lower limb, and then we have 120, upper and lower limb bones. Not trunk is not the brain, and the neck is not the. So multiply 12 by the number of by 100, that's 1,000. I mean, it is insane. It's beyond even the 60 days I told you stuff. So but this channel, studying together and storing it together and pushing it together and practicing retrieving it together is going to help us. Are you following? It's going to help us to do what? To internalize this concept in piecemeal and making it very simple. Do you follow? All right. So you take water, all right, from time to time. That's, medical students and medical can be the worst patients. All right, that is, they can study for hours, they don't read, they don't eat, they don't drink. It's bad. You need to help your metabolic system, lubricate your system, water. Okay, so as you are planning to help people and study to help you, be helping yourself, you eat, you drink. Okay, every 1 hour to 2 hours or 3, you take some water. It doesn't need to be gum. No, you space it. All right. Some of the things you learn too. Take water to class. Take water to study center. All right. Yeah. And even say one of the things that help you to keep alert is when water touches your cervical plexus. All right. Some people put hand in waterproof. It doesn't work. There's a place that controls sleep. These are some of the things you learn. So I've digressed a whole lot before we get into our 1 hour, because I said it's going to be a 1 hour test run to check how this thing goes. Is it possible? And it's been a dream for me. I've been looking at this thing for almost a year now, and how to study life with people, how to store it life with people, and how to and everything. All right. So now we said those 48 topics that should be taught in 12 weeks, in 25 weeks. 6 weeks is dedicated to bones alone. Can you imagine that? 6 weeks. 6 weeks dedicated to bones alone. See, 6 weeks. Not even joint. Joint, that's his own. And when I check, 13 topics was on bones. 13. That's 10 plus 3 was on bones. And then for joint, it was 10 topics. Now, that is for a certain institution. I checked their curriculum for upper and lower limb. For others, it's beyond. Now, for thorax, abdomen, pelvis, and perineum, I discovered that they had about 4 lecturers, professors and doctors. In fact, completely professors, both clinical professors and anatomical professors. And I mean clinical professors that are medical doctors, and they're also teaching anatomy. Okay, guess what? I discovered that one of them gave them 12 materials. Can you imagine? 12. The other one gave 6 materials. This one gave, 5 topics. This one has hit them on 4 and is promising them some more. So if you add 6 to 12, that's how many? 18. 18 to another to 5, that's 23. 23 to 4, that's 27. 27 materials. Can you imagine that? We are not saying 27 pages. 27. One of those materials I was checking, 75 pages, brother, with structures, with diagrams. And you see, anatomy is one course that you write theory. Others may be writing objective, you write theory. And not only that, when you think you have crammed enough, they start viva, oral exams, interview, to be sure if you really know or you were cramming or someone, hint you or you use a microchip or something. They want to be sure, they don't want to produce a half-baked, incomplete medical practitioner. You see? So it's just too much. And those 27 things you have to do it between September and guess what? Between April, little bit of March and July. Not even July itself or so, the shorter. The rest of the day, expect you to go on only or to read and wait or do some extension program, all that, depending. Or stay back and study while others are going, because medical students run a different purpose. Others can be on holiday and you have to stay back, have to still do study. Or then maybe the time they are not examining you or something or giving you God's assessment. So I noticed that, okay, so now subtract out of 48 topics. I said 13 is for bones alone, bones of upper and lower limb. And then 10 is for joints, joint of upper and lower limb. Of 13, how many? Drop it in the comments box. If you are following, drop in the comments box. Yes, if you are playing this back, if you are live, drop the message. Yeah, drop the message. Drop how many? Drop. If you are following me live, drop. Let's be sure we are not just wasting time, killing time. Let's be sure. You drop it, type it in the comment section. Subscribe to type. I didn't say drop emoji, type. 10 plus 13 is how many? Type it. Let's be sure you are with us. And if you are playing this back, because this live session should be recorded and sent, you also type in the comment. Let's be sure. Okay, you've watched this part of the clip. Okay, all right. So now, out of 48, you have 23 that is on bones and joints. That was why we reduced it. Instead of saying 48, we say 17. Are you following it now? Yeah. Yeah, that's how we see it. Like plexus. We reduce plexus to 1. We have brachial plexus. We have lumbar plexus. We have sacral plexus, lumbosacral plexus, coccygeal plexus. All those plexuses, in fact, even any other plexus, where the plexus is in upper and lower limb, or the plexus is in TAPP, or the plexus is in head and neck. However, what we are doing is that we reduce in such a way that if you had a good foundation of these 17 topics, anything that relates to it, you get it. I'm telling you, if they teach anything related to it in your second in course or your third in course, or even in any other clinical days, guess what? You don't need to stress that you already got to that foundation. Are you getting that point? Thumbs up if you are with me. Yes. Thumbs up if you are with me. Thumbs up if you are with me. Do you follow? All right. So now, okay, those 17 topics, I reduce it to mnemonics. Here's the difference between mnemonics and acronym. Mnemonics are words that you are used to, which you use it to represent new words that you are not used to, so that you will be used to. That need to sink in. So let me give you 10 seconds. Mnemonics are words that you are used to, which you use to connect with words that you are not used to, so that you will be used to. Write it down. Give you seconds. Write it down. So if you've listened to this one, drop it in the comments. Okay. Now, we move away from there. We said acronym also exists. You may have heard of acronym. Acronym is when you pick the first letter of words from different words. Okay. Or the first letter and any other letter from different words to form a word you are used to, so that you use it to remember new words or group of words you want to be used to. So there's 17 topics I want to discuss. If you or your outline for study in upper and lower limb is without this shape, like cubital fossa, gluteal fossa, another fossa, a word like nerve or nerve plexus, a word like or topics like veins or venous drainage, lymphatic drainage, words like organs, words like spaces. Okay, so to remember all of them, you need just one sentence, and I'm going to give you the sentence now. So if you listen to the sentence, write out the sentence and the topics. Please, I'm going to take it slowly because we said we internalize medical concept in piecemeal. So I'm going to take it in piecemeal, little by little. Piece by piece. No matter how hungry you are, you can't swallow a pot of rice. It's not possible. Some people can sound so literature, so literal. They say, I'm so hungry, I can eat an elephant, I can eat a whole goat. And my brother, no matter how hungry you are, you cannot finish a pot of rice. You can't. You have to take it spoon by spoon, little by little. So that's what we are going to be doing. No matter how excited that you stumble on a channel that you're going to send to people, they think they're learning here. They can even use it in their nursery school, in their primary school, in their secondary school, in their tutorial center, in their this. Guess what? Whatever is the case, you have to learn this one little by little. So let's go. Please, as I'm saying, write it in your lecture note. Write in your raw book. You should have a book you write your rough. You should have a book you write your summary. Okay, summary. Okay, so number 1. Please, that's write two columns. The first column, is for mnemonics. That is for those 17 topics. Are you following? All right. If there's anything I promise you, like how to generate these mnemonics to fit your own, maybe your words, your comments. Some people like add food, some people like agric, some people like toys, some people like sports, some people like anime, some people like cartoons, some people like movie stars, some people like, do you follow? Something like men of God, some people like inventors, whatever you are comfortable with. We will raise a session, so if you need it, let us know. We'll teach you how to get this thing done so that you can understand. So maybe you are the type that love sports. You can use the sport you love to learn your anatomy and internalize it very well. Do you follow? Okay, so now we will use medical concept. So listen to this. Please never ask very old students question. Many fail comprehensive joint board exams because brachial anatomy always feel challenging. So I'm going to say slowly again. Now, this one I'm saying now, every word I say, this one now, not the previous one, this one I'm saying now, every word I say and stop is on a line. If I say another word, is on another line. Do you follow? Good. Now, please. Have you written please? Okay. Please never ask very old students question. That's a little mistake there, so I'm going to say that again. Please never ask very old student question. Meaning the 6th word, which is student question, those 2 words, student question, should be on a line on its own. So please is on a line, never is on a line, ask is another line, old is another line, question is another line, Student question is on the 6th line. So the 6th line will have student question, okay, on the column of mnemonics. So please never ask very old students question. Have you gotten that? Next line. Many, that's the 7th one now. Many, okay, many fail comprehensive joint board exams. Okay. So I'm going to take that again. Please never ask very old students question. No, student question. Student question is on the 6th line. Okay. Many fail comprehensive joint board exams. Board exams is on one line. So many is on one line, fail is on another line, comprehensive is on another line, joint is on another line, board exams, the two word board exams is on one line. Okay. So I'm going to take it all over again from the beginning, and this one makes it internalization. You make it over and over. Repetition brings retention. Okay. Please never ask very old student question. Next one. Many fail comprehensive joint board exams. So board exams is another line. Next one. Because brachial anatomy always feel challenging. I'm going to say that again. Please never ask very old student questions. Many fail comprehensive joint board exams because brachial anatomy always feel challenging. Are you seeing it now? 17. I reduced 48 topics to 17 mnemonics. Now, what does this mnemonic stand for? Please stands for popliteal fossa and cubital fossa. Or you can say popliteal stroke cubital fossae. So fossa for singular, fossae for plural. Now, nerve stands for nerve supply or nervous plexus or nerve plexus. ASC stands for arteries as well as anastomosis. These are topics. Okay, these are topics. Remember, I told you I've grouped topics into one topic. For example, now when you talk about anastomosis, there are several anastomosis. Lecturer can come to class and say, today want to learn anastomosis of the scapula. Today want to learn anastomosis of the elbow. Tomorrow he wants to learn cruciate anastomosis. Or want to learn the knee anastomosis or genicular anastomosis, whatever. Okay, so same question you never want to be asked. Same question. Okay, ask your question if you have any in the comment section. Okay. So now we are done with please never ask. That is please for popliteal or cubital fossae. Never for nerve supply or nerve or nervous nerve supply or nerve plexus. Okay. Then ask for arteries as well as anastomosis, and then OD is for organs, right? Student question is for spaces in bracket quadrangular space. Are you seeing it now? That's why we say SQ, student question. Student is for space, question is example of a space, quadrangular space. Do you follow? Yeah. Each time I hear quadrangular space, I remember this. You know, some people when they snap picture, they do this, some people will do this, some people will do this. They don't know that that same thing you are doing in your snapping is anatomy. There are three spaces there, Don't worry, we are not teaching that today, we are not analyzing that today. We are going to do a short video clip on that. Okay, but now let's just want to, we are done with student question. The next one, many stands for muscle. There are several muscles. Many stands for muscles. Fail stands for frash. Frash is F bracket open R A SCH. What does that mean? F for femoral. Why I say bracket open is because it's femoral artery, FA, femoral sheath, FS, femoral canal, FC, femoral hernia. Are you following that? That's why we call it FRASH. You need to pause and say that again. You need to rewind and say that again. A lot of values in this channel, a lot of values and a lot of content. Empty bag cannot stand. Okay? Yeah. Didn't just sleep and wake up for this. Been working. See now, we study. And you too, if you do this over and over, like I'm trying to do over and over, if you listen to this video over and over, that's why we're going to make short video on just these sessions alone, the session of reducing the 48 topic or 50 topic into this. So if you have a concept you are trying to study and it's difficult, DM us, join the MSc Mastery WhatsApp channel so that we can see your challenge and study with you, because we are in this together. Is that okay? Okay. Now moving away from that, we said, please never ask very old student question. Okay, many fail comprehensive joint board exams because brachial anatomy always feel challenging. Okay, we say please for popliteal occipital fossa, never for nerve or nerve plexus, ask for artery or anastomosis, old for organs, student, very for vein, very old, very for veins, okay, or venous drainage, as well as lymphatic drainage. Do you follow? Vein, very is for veins, is also for venous drainage, is also for lymphatic drainage. All right. Then we move on. We said old is for organs. Student question is for spaces, in bracket quadrangular space. Someone may be asking, oh, how about fossa? Are they not? They probably have, are they not spaces? Yes, they are spaces. Okay, but there are other spaces. Do you follow? Okay. Now, I need to take some water. Okay. So we move on. Yeah, medicated water, not just water. You're going to lay about brain food and brain drink and all. Okay, so we move on. We said when you talk about the nervous, the nerve or the nerves plexus, talk about the artery and anastomosis, talk about the vein, the very for venous drainage or lymphatic drainage of vein. Talk about the student question for spaces and quadrangular space. The next one is many. I said many is for muscle. The next one is fail. Fail is for FRASH. Told you what FRASH is. FRASCH. That is femoral ring, femoral artery, femoral sheath, femoral canal, and femoral hernia. Okay, sheath is spelled SHEATH. Okay, now after that, the next one is comprehensive. Comprehensive stands for cavity. Sorry, canal, not cavity, canal. Example, adductor canal. Okay, it's in the lower limb. Now move away from there. We talk about the board exams. Sorry, the joint board exam. Joint is for joints. And remember, I told you there are about 10 joints in upper and lower limb. Okay, your school may add more or may reduce a little bit. About 10 joints in the upper and lower limb. Okay, so joint is joint. Okay, board exam is for breast and mammary gland. Board exams for breast, mammary gland. Okay, do you follow? Board exams is for breast or mammary gland. Okay, because it's for bone. Because it's for bone, right? And then brachial is for brachial plexus and other plexuses. Or every other plexus is on brachial plexus and other plexuses. Okay. Always is for axilla, this part, axilla. Okay. And then anatomy. So after brachial, you have anatomy, right? Good. So anatomy is for axilla, and then always is for arches. We have arches of the foot and palmar arc. Arches of the foot and palmar arc. Okay, or arches of the palm. And after that, we have classification. Okay, classification of joints and anatomical, and classification of anatomical planes and terms and regions. Do you follow? All these things will be discussed in this channel. Between now and end of this month, you're going to see a whole lot of them in their piecemeal. Now, they will not come so refined. They will not come so well. Ideas don't come fully formed. So we are not in a hurry to learn this. We are learning this slowly. Slow and steady wins the race. You come a little, drop a little short. You may find, oh, this is not the best sticker. It's not the best. It's not catchy. It's not all that glitters that gold. If it's this channel, it has value. I promise you. God is going to spare us grace and asset to be able to see the best, to study with you and store it with you, so that those who could not study with us in the day or in the night, when they come upline, they're going to see this thing. Is that okay now? Okay, so once again, watch out for the link, afternoon link. This thing that we are sharing here, we're going to do it on the board one by one, and we're going to pick bone. So you're going to see how to discuss bone, whatever bone. In fact, we said if you can discuss one bone, if you can see the hack of discussing one bone, forget it, you can discuss any bone. That's the thing. And then we didn't leave you there. How about histology? Histology is all about, for histology of general histology, it's just 4 things you need to know. C-MEN, C-M-E-N. That's all. C-M-E-N. 1, 2, 3, finish. That's all. 1, 2, 3, finish. That's all. That's about histology. And embryology is not difficult. Now, come on. If you can understand week 1, week 2, week 3, week 4, that's all. General embryology is all about what happens in week 1, what happens in week 2, what happens in week 3, what happens in week 4, and you're done. Now, even if you're asked to talk about what happened between week 1 and the last week, that is the first day, all right, till the 9th month, it's not difficult. You just need a hack. First, you must understand area of concentration. What does particular scheme expect you to know in that first clinical year, and then the second clinical in-course work? Do you get? You just need to understand that. So it's not reading at means. It's not studying at means. You must understand how to study, why you study. Do you get? And a skill to study. Don't worry, you'll be fine. You'll be fine. Okay, we've already started. We finished the first one, which is epithelial tissue. Okay, in histology. Histology is just the study of tissue. Okay, a branch of anatomy that deals with the study of tissue, and tissue is classified into 4, and then which is what? Epithelial tissue. Okay, C, connective tissue, M, muscle tissue, E, epithelial tissue, and N is a nerve tissue. And it's not difficult. Connective tissue, muscle tissue, and you're good. That's all about histology. That's all. Then we talk about systemic histology. Okay, that's the different systems in the human body and the tissues that line them up. The epithelial linings on them, the connective tissue on them, the muscle tissue on them, the nerve that supplied it. That's all. That's all about year 2. Do you see? Is it not simple? Is it not simple? It's simple. So don't. And even though we say it's simple, it does not mean you come in. That's how they will tell you. Those people will tell you a lot of things, and you look strange. And in fact, it will sound like what Jesus said. This is a hard saying. Okay, someone is asking, what about FEWS? FEWS stands for femoral triangle. Thank you. That's a good one. It means someone is full. It means this is helpful to someone. Thank you, Daniela. I feel like calling you Dr. Daniela, okay? Because that's like dragging the future closer. The next 4 or 5 years or so, depending on the level you are, okay? I drag it closer. That's foresight. That's one of my core values, foresight. Okay, I believe that if you get it now, there's nothing that can take it away from you. I'm telling you. It's just like the hymn of a song, or it's just like your name. Like you can't forget your name or your gender. Come on, it's not possible. See, if it's possible, you just need to blink your eye, and guess what? You're good. You have Abducen muscles. Sorry, you have Abducen nerve, one of the 12 cranial nerves. Abducen nerves. We bring it to play, and you are good. Okay, so I've been able to demystify upper and lower limb, been able to demystify histology and embryology, general histology, general systemic histology, general embryology. I've told you about what happened with 1, with 2, with 3, with 4, and then we talk about systemic embryology. Just when a certain system form. Embryology has to do with the formation of the embryo. When a certain system form, which one form first, which structure form first, how we form, and all that. That's all. That's about systemic, and it's not difficult. Not difficult. So you have GIT histology, GIT embryology. Okay, which lining, which tissue line it, which connective tissue connects this one to this one. That's histology. Embryology, which one formed, when was it formed? Okay, like week 1 is a week of fertilization, week 2 is a week of bilaminar gem disc formation, or we say week of two things occur. Week 3, a week of gastrulation, or the week of 3, when something that was 2 changed to 3. Do you get? So it's not something difficult. Then week 4 is a week of folding. Now tell me that is difficult. So it's not difficult. So just stay with us as we understand this in piecemeal. Do you follow? All right. So then we now talk about thorax. That's TAPP, thorax, abdomen, pelvis, and perineum. Thorax is not difficult. It's all about your rib cage. Okay, and then abdomen-pelvic region, abdomen and pelvis. There's no structural separation, so we call it abdomen and pelvic, abdomen-pelvic region. Okay, the region between the thoracic diaphragm and the pelvic diaphragm. Okay, just before you get to the perineum. And then the perineum is the region where you have the anal orifice and the external genitalia. That's all. What you find between the legs, between the two lower limbs. That's the perineum. So what's difficult is not. So what is usually difficult is the radiographic appearance. That's what is very difficult. I have to read the radiographs, the images. And then when you see the way we structure it. We said if you are studying abdominopelvic radiographic appearance, we said you just need to rest. That's the acronym RES. What are the radiographic appearance? What are the extent? And what are the surrounding structures I will show? Is that difficult? Don't worry, when we check this, you're going to see how this thing is modeled in a very easy way. All right? Okay. So ladies and gentlemen, with this we come to the end of Let's Gather and Demystify Anatomy. Anatomy made simple, anatomy simplified. It was a wonderful time. Let's say your comment, let's say your feedback. As you come to get through this, share the channel, subscribe to the channel, share on your status, share on your timeline, your social media. Let's go viral. Let a lot of people's life be changed. Let's help to destroy people's ignorance politely. Remember, education is a gradual discovery of our ignorance. You're going to see that at times we teach from book, at times we internalize, at times we ask questions. At times we all live session, Google Meet, YouTube's live session, and all that, just to make sure we get it close. At times we'll be doing question and answer session, we're taking question and answer session. At times we'll be bringing structures, bones. At times we'll be doing a whole lot. All this is to make sure you capture the picture of your promising future, which you must picture. If you hear, say, I hear. All right, fantastic. You see, when you are happy, you recall, and you need to eat well, sleep well, you need to meet again. So once again, don't forget, we meet by 12:05. The link will be sent in the channel. The link will be sent to the different group and timeline. Make sure you share it. Make sure you get to be happy. Share with your friends. Okay, now that it is free, because there is there's a demand that we should make it a paid version, but we are too busy studying and reading, storing, and finding easier way to remember all these things in the human body. Can you imagine for me to fold my face like this? People studying head and neck said it takes 72 muscles to get angry. That's to frown your face. And it takes 47 muscles to do what? To smile. You don't say hi. Do you understand? It takes 47 muscles. Can you imagine that? It takes 47 muscles. Now, like we said, the scapula alone, the shoulder blade alone, has 17 muscles. Can you imagine that? The forearm muscles alone, about 20 muscles. Okay, the muscles of the hand, about 2 gates. So a lot of things to be learned, and we are trying to say that the measure we are taking is going to make it simplified for you. Just do your own part. Your own part is subscribe, like, comment, give healthy comment, ask good questions, okay? And then share the link in your status, screenshot and send to us. Let's be sure you are part of those who want to help destroy ignorance, because it's killing people that are making us to go and study medicine and surgery, nursing, pharmacy, and all these clinical and paraclinical courses. It is ignorance. I call it disease of ignorance. So as we are studying, we need to learn. So as you're learning, teach someone. Teach your aged mother, teach your aged father, teach your lovely mother, teach your younger mother, teach your sibling, teach your friends. Share it. When you teach, you reach. You tune them up to appreciate, and guess what? They will live longer. So while they are sending you to study medicine, they are studying you as the medicine they see. Yes, I hear. So this way we're going to end it. It's been 1 hour, 18 minutes. Okay, as if we just started. I wish we should just start. Okay, let's stand up now and begin to say the next one. But guess what? Whatever has a beginning has an end. This way we'll end the morning session. Don't forget, the afternoon session starts by 12:05. We'll send the link, share it, and we're going to buy the rest. Give us your honest feedback. Was this a better thing? What do you think we should do? How can we get this better to make sure we reach out to many lives and we understand this medicine and surgery and this anatomy and physiology and this biochemistry? We are going to make anatomy clinical live session also, but it's going to be from next month. Okay, live session for biochemistry and physiology is going to start from the month of August, and that's going to be a wonderful session. I'm telling you, it's going to be a wonderful session. So please, okay, it depends on you. We need to hit at least 1,000 subscribers, 10,000 views to be able to achieve that, okay? Because we don't just want to waste data, we don't just want to kill time, we want to impact both ourselves. As we are teaching you, we are teaching ourselves. As we are getting to make sure we are checking up on you, we are checking up ourselves. We check up on you, you check up on us. You ask us, why are you not teaching again? I ask, why are you not reading again? Why are you not sending feedback again? And so together, we give ourselves a handheld process to the top. See you at the top. Thank you.